Osteoarthritis of the hip is a specific type of osteoarthritis that affects the hip joint, leading to the degeneration of cartilage, changes in the underlying bone, and inflammation of the joint. It is a common condition that can cause significant pain and disability, particularly in older adults. Causes and risk factors. Osteoarthritis of the hip can be caused by various factors, including age. The risk of developing hip osteoarthritis increases with age, as cartilage naturally wears down over time. Genetics. The family history of osteoarthritis may increase the likelihood of developing the condition. Obesity. Excess weight puts additional stress on weight-bearing joints, including the hips. Joint injuries. Previous injuries to the hip, such as fractures or ligament tears, can lead to cartilage damage and increase the risk of OA. Overuse. Repetitive stress on the hip joint from certain occupations or sports can contribute to the development of osteoarthritis. Gender. Women are more likely to develop hip osteoarthritis than men, especially after menopause. Underlying conditions. Conditions such as rheumatoid arthritis, metabolic disorders e.g., hemochromatosis, or developmental disorders e.g., hip dysplasia can predispose individuals to hip osteoarthritis. Symptoms. Symptoms of hip osteoarthritis can vary in severity and may include pain in the hip joint, which may be localized or radiate to the groin, thigh, or knee. Pain may worsen with activity and improve with rest. Stiffness, particularly noticeable in the morning or after long periods of inactivity. This stiffness can limit mobility. Swelling. Inflammation may cause swelling in and around the hip joint. Decreased range of motion. Difficulty moving the hip joint, leading to challenges with daily activities such as bending, walking, or climbing stairs. Crepitude. A grating sensation or sound when moving the hip joint, often caused by roughened cartilage. Weakness. Muscles around the hip may weaken due to pain and disuse. Diagnosis. Diagnosing osteoarthritis of the hip typically involves medical history. The healthcare provider will take a detailed history, including symptoms, duration, and any previous injuries. Physical examination. A thorough examination of the hip joint, checking for pain, swelling, range of motion, and strength. Imaging tests. X-rays. The primary imaging method for diagnosing hip OA. X-rays can reveal changes such as joint space narrowing, bone spurs, and alterations in bone structure. MRI may be used in certain cases to assess the cartilage and soft tissues more closely, especially if surgery is being considered. Laboratory tests. Blood tests may be done to rule out other types of arthritis, although they are not specifically used to diagnose osteoarthritis. Treatment. While there is no cure for osteoarthritis of the hip, various treatment options can help manage symptoms and improve function. Lifestyle modifications. Weight management. Losing weight can significantly relieve pressure on the hip joint and reduce symptoms. Exercise. Engaging in low-impact activities such as swimming, cycling, or walking can strengthen the muscles around the hip and improve flexibility. Physical therapy. A physical therapist can develop a tailored exercise program to enhance joint function and relieve pain. Medications. Pain relievers. Over-the-counter medications like acetaminophen or NSAIDs e.g., ibuprofen, naproxen can help reduce pain and inflammation. Topical treatments. Creams or patches containing pain relievers can be applied to the skin over the affected joint. Corticosteroid injections. Injecting corticosteroids directly into the hip joint can provide temporary relief from inflammation and pain. Assistive devices. Using canes, walkers, or other assisted devices can help alleviate pressure on the hip joint and improve mobility. Surgical options. If conservative treatments fail to provide relief, surgical options may be considered, including arthroscopy, the minimally invasive procedure to clean out the joint or remove loose fragments. Osteotomy, reshaping the bones to relieve pressure on the hip joint. Hip replacement surgery, In severe cases, replacing the damaged hip joint with an artificial joint may be necessary. This is often considered when pain significantly interferes with daily activities. Prognosis. The prognosis for hip osteoarthritis varies based on several factors, including the severity of the disease, age, overall health, and response to treatment. Many individuals can manage their symptoms effectively and maintain a good quality of life with appropriate interventions. Prevention. While it may not be possible to prevent osteoarthritis of the hip entirely, certain strategies can help reduce the risk. Maintain a healthy weight. Keeping weight within a healthy range can significantly decrease stress on the hip joint. Stay active. Engaging in regular, low-impact physical activity can strengthen muscles and maintain joint health. Protect joints. Use proper techniques and equipment when participating in sports or physical activities to prevent injuries. Seek prompt treatment for injuries. Addressing joint injuries early can help prevent future issues. Conclusion. Osteoarthritis of the hip is a common degenerative joint disease that can cause significant pain and limit mobility. Understanding the risk factors, recognizing symptoms, and seeking timely medical intervention can lead to effective management of the condition. The combination of lifestyle changes, physical therapy, medications, and, in some cases, surgery can help individuals lead active and fulfilling lives despite the challenges posed by hip osteoarthritis. Regular follow-up with healthcare providers is essential for optimizing treatment and monitoring the progression of the disease.